So now we're going to work the QL, the quadratus lumborum. The QL is a bilateral muscle. There's one on the left, one on the right. The QL is comprised of 3 distinct raphe or fiber orientations. That's why when you stretch the QL, it generally needs a couple of different stretches at a couple of different angles to fully release this little muscle. I say little muscle, it's a very problematic muscle. When people complain of lower back pain, they normally go to their QL and sacroiliac area. The QL is a lateral bender of the spine. It's an extender of the spine also bilaterally, and in very poor mechanically advantaged positions it also becomes a flexor of the spine. And when that happens, that's when it becomes a problem, because that's not its true job. And it will become a flexor of the spine due to the anatomy and the insertion point on the 12th rib. So we don't want to use the QL as a flexor, we want to use the QL as an extensor. So a couple of ways of stretching this muscle, and I'm going to show you 2 or 3 right now. So we start with the client, Kiki, on her side. So the first thing we want to do, we want to straighten their leg. So we're going to use their leg to drive the stretch. So a couple of ways of doing this. I get them with a slight extension, if indeed they have it, and I put their leg in between my knees. You can probably see that on camera here. So I block her calf with my legs, and that allows me to distract her body. Notice Kiki's other hip is about 90 degrees. That just keeps the ligaments in the lower back somewhat stiff and secure and gives her a bit of stability. So what we're going to do, I'm going to traction her lower leg, I'm going to cup the underside of her quad, hamstring, groin, and I'm going to cup the iliac crest. So I ask her to take a deep breath in. As she breathes out, I lean back and I just pull. We hold for 3, 2, 1, release. I cup and pull. 3, 2, 1, release. We can use 2 hands. So when we're using 2 hands, I really clamp down on the glutes and the hips. So I cup, I brace my arms, I use my legs, I keep my back flat to protect my own back, and I just step back and down. Hold, 3, 2, release. So you should see the movement of Kiki's skin here, right? So we get a nice lateral body stretch. How's that feel? Good. Good. We can go into varying range of extension, and that will affect the lower back slightly. So notice as I move Kiki more into extension, I'll pull her hip forward so it's true hip joint as opposed to rotation, and I'll do the same traction this way. For some people, smaller therapists, bigger clients, this position can be a bit labor intensive. So we can come around this way. Kiki, bring your leg back up for me. So now we're going to place a bolster or a towel, a Queen's Park Rangers towel in my case, underneath the opposite lower back. And what this does, this just puts a bit of side bend in the lower back, so it gives us a better stretch. So Kiki's going to hang the leg off the bed. And I'm going to come here on the hip. So this is the trochanter, iliac crest. And I'm going to push her away to get a stretch. Some clients will tolerate a bilateral hip. How's that feel?
Good.
So basically what we're trying to do here, guys, we're trying to create space between the crest of the ilium and the 12th rib. This way. I'm pushing. I'm just trying to stretch that tissue. I can come way forward on the iliac crest and work my way laterally, which I commonly do. And when you're working on the bone, you're going to find some periosteal pain points. There's going to be some tendons on this bone, and that's a sign of tension, trigger points. Another way to myofascially try and release the QL, I'm going to hook on the 12th rib with my soft part of my forearm. I'm going to hook just above the greater trochanter, there's a soft spot there. I can apply a fair amount of pressure here. On the rib, not so much. So I'm pushing this way. Okay? I'm pushing this way, and I hook, and I use my hands to just spread. So you can see the skin stretching. And this is a myofascial stretch. And here we can stay here 1, 2, 3 minutes. You really, and I commonly do it from the other side as well. I'm just showing you for camera purposes, this side of course. And what we can do, we can ask the client to extend their leg a little bit, and then let it go heavy. Relax. So you literally just hang, you can oscillate your body, push forward. So see, I'm doing this rotation. So the intention is always this area. Many different ways. So the favorite of mine is to clamp the leg and pull whilst depressing the ilium. You can come in and do a real a long, slow, sustained myofascial release technique. QL is a very troublesome muscle, like I said in the intro. It's coupled with issues normally in the glute med because they're kind of synergistic in abduction and side flexion of the spine. Psoas must be checked when you're addressing QL. So the QL is very rarely a single myofascial issue. You have to look at the neighboring muscles, which we'll delve in deeper into as the academy progresses.